100 million Americans are drowning in medical debt right now. That's according to a 2022 KFF Health News investigation. And here's what nobody tells you, most of those bills? They're negotiable. I'm talking 30%, 50%, sometimes even 80% off. Today, I'm going to show you exactly how to do it. Hey, welcome back to the channel. If you're new here, I spent 15 years working inside the medical billing industry. I've seen the tricks, I've seen the markups, and I've helped thousands of people just like you cut their bills in half, or better. In the next 10 minutes, you're going to learn the exact script I use, the magic phone number to call, and the 4-step system that turns a scary $10,000 bill into something you can actually afford. Stick around to the end. I'm walking you through a real-life example where a viewer saved over $6,000 in one phone call. Before we dive in, this video is for educational purposes only and is not legal or financial advice. Always consult a qualified professional for your specific situation. Cool? Let's get into it. Step 1. Before you negotiate a single dollar, you need to ask for an itemized bill. Now what does that mean? Think of it like a grocery store receipt. When you check out at the supermarket, you don't just see groceries, $187. You see every single item, the bread, the milk, the eggs, each with its own price. An itemized medical bill is the same thing. It lists every single charge, every aspirin, every cotton swab, every minute in the operating room. Why does this matter? Because according to a Medical Billing Advocates of America estimate, around 80% of medical bills contain errors. 8 out of 10. You can't catch an error if you can't see what you're being charged for. So your very first phone call is to the billing department. Use this exact sentence: "Hi, I'd like to request a fully itemized bill with CPT and HCPCS codes mailed or emailed to me." That's it. They legally have to provide it. CPT and HCPCS, those are just the standardized codes hospitals use for procedures and supplies. Don't worry, you don't need to memorize them. You just need them on the page. Once you have that itemized bill, look for 3 things. 1. Duplicate charges. Did they bill you twice for the same lab test? It happens constantly. 2. Services you never received. Did they charge you for a private room when you were in a shared room? Did they bill for medications you refused? 3. Outrageous markups. A $4 bag of saline solution can show up on your bill as $200. I'm not exaggerating. Step 2. Find out what the procedure actually should cost. This is your secret weapon. Hospitals charge wildly different prices to different people for the exact same service. The cash price, the insurance price, the Medicare price, they're all different. And here's the thing, Medicare's price is usually the lowest, and it's publicly available. Go to 2 free websites. First, fairhealthconsumer.org. Plug in your procedure code and your zip code. It'll tell you the typical cost in your area. Second, the Healthcare Bluebook at healthcarebluebook.com. Same idea, fair market pricing. Now go to cms.gov, that's the Centers for Medicare and Medicaid Services, and you can look up what Medicare pays for that same procedure. Here's a stat that'll blow your mind. A 2020 RAND Corporation study found that hospitals charge private insurance patients an average of 247% of what Medicare pays for the same service. 2.5 times more. So when you call to negotiate, you're going to use those numbers as your anchor. Step 3. Pick your negotiation strategy. There are 3 main paths, and you choose based on your situation. Path 1 is financial assistance, sometimes called charity care. If you're a nonprofit hospital, and roughly 58% of U.S. hospitals are nonprofit, according to the American Hospital Association, they are legally required under the Affordable Care Act to have a financial assistance policy. Many will completely wipe out your bill if you make under a certain income, often 200 to 400% of the federal poverty level. A family of 4 making $90,000 a year can often qualify for partial assistance. Most people don't even know to ask. The magic phrase, "I'd like to apply for your financial assistance program. Can you send me the application?" Path 2 is the prompt pay discount. This is for folks who can scrape together some cash. Hospitals would rather get 50 cents on the dollar today than chase you for years. Call and say, "I can pay today if you offer me a significant discount." What's the best you can do? Then, and this is critical, be quiet. Let them make the first offer. Whatever number they say, counter with about half of that. I've personally seen people get 40 to 60% off just by asking this one question. Path 3 is a payment plan with a settlement offer. If you can't pay a lump sum, ask for an interest-free payment plan and a reduced balance. Hospitals almost never charge interest on internal payment plans, but you have to ask, and you have to get it in writing. Whatever you do, do not put your medical bill on a credit card unless it's a 0% promotional offer that you can pay off in full. Credit card interest will destroy you faster than the original bill. Step 4. Make the actual phone call. Here's where most people freeze up. They get nervous, they accept the first offer, they hang up and cry. I get it. So let me give you the exact framework I use. First, call the billing department directly, not the collections agency if you can avoid it. Get to a human. Be polite, and I mean genuinely polite. The person on the other end has heard 1,000 angry calls today. Be the nice one. They have way more discretion than you think. Open with this, "Hi, my name is," your name. "I received a bill for $8,000, and I've been reviewing it carefully. I found some concerns, and I also want to discuss a reduced settlement. Who can I speak with about that?" If they say they can help, great. If not, ask for a supervisor or a financial counselor. Those words, financial counselor, open doors. Every single call, write down the date, the name of the person, their employee ID if you can get it, and exactly what they agreed to. Then ask them to email or mail you written confirmation before you pay a single penny. If they won't put it in writing, the deal doesn't exist. Okay, let me walk you through a real example. A viewer named Sarah, I'm changing her name for privacy, sent me her bill last year. She'd had an emergency appendectomy. Her insurance covered part of it, but she was left owing $14,200 after her deductible and co-insurance. She was panicking. Step 1, she requested an itemized bill. When it came, we found 2 duplicate charges for the same blood panel, that was $340 right there. We found a charge for a surgical kit listed at $1,200 that should have been bundled into the operating room fee. Already, just from errors, she could legitimately dispute $1,540. Step 2, she looked up the fair price. The Medicare rate for an uncomplicated laparoscopic appendectomy in her region was around $4,800. The hospital had charged her insurance over $40,000 total. Her remaining $12,660 balance was still way above what Medicare would have paid for the patient portion. Step 3, she chose her angle. Sarah and her husband made about $72,000 a year with 2 kids. She qualified for partial financial assistance at her nonprofit hospital. The application took 20 minutes. They wiped out 40% of her remaining balance right off the bat. Step 4, she made the call. She used the script. She said, "I can pay $4,000 today to settle this account in full. Based on Medicare rates and my financial situation, this is what I can do." The rep put her on hold, came back, and countered at $6,000. Sarah said, "I can do $4,500 today, final offer." They accepted. They emailed her written confirmation. She paid. Account closed. Sarah saved $9,700. That's a used car. That's a year of childcare. That's a real difference in a real family's life. And she did it in about 3 hours of total work spread across 2 weeks. You can do this too. Now listen, I know this feels overwhelming when you're staring at a stack of bills. So here's what I want you to do today. Pause this video. Grab one bill, just one. Call the number on it. Say these 11 words: "I'd like to request a fully itemized bill, please." That's your first step. That's it. You don't have to negotiate today. You don't have to do everything at once. You just have to start.